The patient was a 29-year-old male. He is a newly diagnosed diabetic. He received a nutrition consult for his newly diagnosed diabetes and for hyperglycemia. The patient was seen in urgent care. He presented with a blood glucose of 598. He states that his symptoms had presented over the past week, which were nervousness, sweating, anxiety, just kind of not feeling well overall. Over the last 2 months, the patient has had a lot of stress in his life. He had a new baby, and his mother-in-law was very ill, and she was in the hospital, and she remains in the hospital too, so he's just been very overwhelmed. He states that his diet has been poor. He frequently consumes Kool-Aid, soda, sweet tea, fried foods, and is often eating on the go and going through drive-thrus. The patient also is not participating in any physical activity. He's currently unemployed due to family matters, and he lives with his wife and new baby. He denies tobacco use and drinks alcohol on occasion. The patient's diet order was 75 grams carbohydrate at each meal. His feeding ability was independent, and he had no oral problems, no difficulty with chewing, swallowing, anything like that. The patient presented and did not appear to be in any acute distress. He was alert and oriented, no problems with his lungs or breathing. His abdomen was soft and non-distended, and bowel sounds were present. So as I said before, the patient was 29 years old. His height was 73 inches. His current weight is 114 kilograms or 250.8 pounds. His ideal body weight is 83.3 kilograms with an adjusted body weight of 91.05 kilograms. The patient is class 1 obese with a BMI of 33.25. Relevant labs, his blood glucose was 279. This was the following morning after he was admitted into the hospital. His one touches were 240, 308, 396, 327, and 354. The patient's past medical history, he has GERD, but his family history is significant for diabetes and hypertension. So medications, while he was in the hospital, he was on IV fluids, Zofran, and metformin, which he would be also going home on. His skin was intact with a Braden of 23, no problems with that. His calorie needs were based off of 91 kilograms, or adjusted body weight. We calculated 20 calories per kilogram, 1,800 calories a day, which was also to help assist with a little bit of weight loss. His protein needs 1 gram per kilogram of adjusted body weight, about 90 grams. And his fluid needs would be 1 milliliter per kcal, or 1,800 milliliters a day. His nutrition diagnosis: food and nutrition related knowledge deficit, and this is related to a new onset of diabetes. The signs and symptoms: his A1C was 10.3, and we received a consult, which is also a sign that he needed the education. The second problem or diagnosis was obese class 1, related to his sedentary lifestyle and poor food choices, and this was evidenced by his BMI of 33.25. So his intervention: meals and snacks, a carbohydrate modified diet. The goal was for the patient to tolerate the 75 gram carbohydrate diet, and nutrition education for the patient to receive diabetes education and education to assist in weight loss. And the patient and his wife were very receptive to this. I spent about an hour going through multiple handouts with them and just went over all of their concerns, went over what a carbohydrate is, why you should have carbs in your diet, and why you should keep them consistent and spread out throughout the day. And he also stated that he had some hypoglycemic episode, so I talked to him about the 15-15-15 rule. And I really do believe that the patient and his wife were going to adhere to these recommendations and to this education when they got home. So, monitoring for this patient, his blood glucose to be under 200, his A1C to be less than or equal to 7 in 3 months when they would draw his labs again for this, and his BMI to be closer to 25, which is of a healthy weight.